Welcome, everyone, to IGH's webinar on homeless prevention, bridging research to practice. I want to thank our speakers for providing their time and expertise on this important topic. Before we get started, I just wanted to go over a few ways you can connect with the Ruff Institute of Global Homelessness, including connecting on our social media platforms and going on our website and seeing how you can work with us. This video will also be posted to our YouTube, and we'll be providing additional resources on homeless prevention after the webinar. So I want to turn it over to IGH's Executive Director, Lydia Stazen, who will be moderating this session. Over to you, Lydia.
As we get right into it, I am going to be introducing our first speaker. I'm getting distracted by all our friends in the chat, friends from the United Nations, Canada, Pierrette, who's been part of our working group to end homelessness from Florida, Vanessa from Spain, Chimji from Mongolia, just so many wonderful friends and colleagues joining us today. So we're going to have a fantastic discussion and conversation thinking about all things homelessness prevention. And so our first speaker today is Pete Mackey. Pete is a professor at the School of Geography and Planning at Cardiff University, which is based in Wales, where his research and advocacy work focuses on homelessness prevention. I first got to know Pete really when we worked together with Abe Oudshorn, who I know is on the call today as well, when we founded the International Journal on Homelessness. And Pete is also the chair of a Welsh homelessness charity. I'm not going to butcher the name there, Pete, so you can tell everyone the name of the charity that you chair. Oh, and I see Lynette Barnes, a former colleague of mine from All Chicago. Lynette taught me everything I know about homelessness prevention. So please continue to introduce yourself in the chat. And Pete, over to you.
Thanks, Lydia, and good afternoon. Pranam, buenas tardes. All right, let's see if we can pass the first hurdle and share these slides. Right. Does somebody want to just give me a yes to say that these are showing?
Yeah. It looks good.
Yeah, great. Okay, so I'm looking into the abyss. I can see nobody. And all I've been told is by Paul Maddin, our translator, is to breathe and speak a little bit slowly so that he can keep up. So apologies if I get excited, Maddin, because we're talking about homelessness prevention. Anyway, so the goal or the task we've been set is to reflect on the bridge between research into practice. And we've got about 10 minutes to do that, each of the speakers. I would like to have spoken to you about three things, but if I'd done that, Maddin would have literally run out of breath. So I'm only going to talk to you about these first two examples. One is about research leading to policy and legislative change through the Housing Wales Act, or as our wonderful colleague Steve Gates calls it, duty to assist. And the second is less about policy and legal change yet, and more about reframing debates at a policy level, but about reframing debates around prevention. And that's through some work we've done around the advancement of a 5-level homelessness prevention typology. But I do want to mention that there are many other ways in which I've been involved and lucky enough to be involved in research that's had impact. And the other example would be through practice innovation. And there's a good example of that through something called the Geelong Project, which we've borrowed from Australia via Canada and are implementing in Wales. But I'm going to focus on the first two examples. So the first example is policy and legislative change through research. And I led a team that was commissioned to evaluate Welsh homelessness legislation. And for those that aren't familiar, the UK and Wales as part of the UK is pretty much unique in that our response to homelessness is largely embedded, or the keystone of our response to homelessness is legislation. That prior to this research in Wales, at least, basically said, if you were homeless and you had children, then there was a duty to accommodate you. But if you didn't have children, if you were single, you pretty much got nothing. And so we sought to review the legislation, and it was a a lengthy process. We used a unique administrative data set from our local authorities. We spoke very, very widely with the sector through key informant interviews. And crucially, we held 3 regional engagement events with 120 attendees from basically any organization that was touching on the issue of homelessness, to understand what were the limits of that legislation and what the opportunities were for change within the confines of actually the review was happening during a time of austerity. I cannot present you the findings of that research in any detail, but to kind of tell you the conclusions were that, look, we'd had this ongoing high levels of homelessness, in fact, increasing levels. Something new, something different needed to happen if we were to go about working towards an end to homelessness. But crucially, this all or nothing system and the inequality in that system was laid to bear. And then most interestingly, I think, is that we unearthed the kind of underdeveloped nature and again, the unequal nature of the delivery of some emergent prevention activity. And the ask really from those we engaged with was this prevention activity needs to be part of our legislative framework. We need to bring prevention into the law. And that's what we called for. So the research set out a whole load of recommendations, and ultimately they led to our Housing Wales Act in 2014. So what does the impact look like? How did this research translate into impact? Well, the Act prioritizes prevention. It says, first and foremost, try and prevent homelessness. And it seeks to reorient services, entitlements, and to a degree, the funding arrangements to try and get more activity around homelessness prevention. And crucially, and this is a really interesting point internationally, is that those prevention services are, there's a universal right. You don't have to be more vulnerable to access the prevention entitlements. Whereas obviously in certainly parts of the US, we've worked a lot on prioritizing who gets support. This was working in the other direction and really argued for a universal right. But then we ended up with a conundrum. So you have great research that says, look, we need prevention into the law. And then you get to the drafting lawyers who say you can't have a duty to prevent, because ultimately somebody's going to fail that duty. And so we ended up with, at the bedrock of the legislation was a concept we call reasonable steps, or as Steve would call it, a duty to assist. So you have to take steps to prevent or relieve homelessness. You've got to have recourse to a wide range of mechanisms of assistance, but there's no absolute duty to house. And to give you an example of some of the impacts of that legislation, I won't go into any detail on the graph, but the orange bars are basically the success rates of prevention for the last 7 years or for 7 years of implementation. And it tells you that we've been around 65 to 68% success rate in our prevention efforts. So that's for any household that makes an application to a local authority, is at risk of homelessness, and local authorities have been successful. That might be through paying rent arrears, but it could be mediation if it's a young person at risk of homelessness because of conflict at home. It's a whole suite of different things. And of course, England have subsequently enacted a very similar piece of legislation. So that's the first example. I think I still have time to now go on to a second example. Let's say this one is less about a policy and legislative change. This one is about reframing debates. And the research aim was to demonstrate the effectiveness, the efficacy of a 5-stage temporally driven homelessness prevention typology. And really, we sought to do this because there are a number of different typologies out there being used. Some are they're more focused on population groups. There are some that are temporally focused, though they're often fairly simplistic, more so than ours. And really, it was to come up with a typology, or to advance a typology, building on work already done by local authorities and practitioners, and then to really test it. Can we use this as some sort of a heuristic tool to well, you'll see, to really look to assess where are we at in our efforts to prevent homelessness and where do we want to be. And our approach was to undertake a review of international literature, which helped us kind of plot out what was going on around prevention, and then drawing on an evidence base of that a wonderful colleague has led on, Suzanne Fitzpatrick, who I co-author this paper with, and Jenny Wood. But also the work is funded by Crisis, a leading UK homelessness charity. And that work that we draw on, we had local authority surveys where we had over 200 local authorities responding, and stakeholder interviews across the UK to really arrive at and test this typology. And I'll just introduce the typology to you. That's the bulk of what I'd like to say. And we identify these 5 levels. The first being universal prevention. And that's, when we say universal, it's population-wide stuff, population-wide activities. It's about reducing poverty. It's about ensuring housing markets are accessible. And if we do those 2 things, we have evidence tells us we'll have a very big impact on reducing and preventing homelessness. Next one, we have upstream prevention. That's where we work really quite far upstream, normally with population groups who we know are at greatest risk of homelessness. So they may be people in institutions who we know are at greater risk of homelessness, for instance, prisons, child welfare system, etc. We then get closer and closer to the point of emergency, to the 3rd tier, which is crisis prevention. And we define that as preventing homelessness where it's likely to occur within a foreseeable time period. And that's fairly easy to enact in a UK context, because we have an eviction notice, which at the time of developing this was 2 months. And so at the point of an eviction notice, we know somebody is likely to become homeless and we intervene. And that's really where the legislation that I've just referred to is playing out. We're currently reviewing the legislation again to see if we can get it to act earlier upstream. Then the typology moves right to emergency prevention. And by that, we mean intervening with people tonight, because if we don't, tomorrow they will be homeless on the streets. And of course, this tells us we want to be acting earlier, because at emergency prevention, our options are fewer. There's far fewer options available to us at point of emergency. And then finally, the one that sits slightly awkwardly is repeat prevention. And that's where homelessness has already occurred, and we're taking action, implementing supports to prevent repeat homelessness. So that's the typology. And really what we found when we applied it to the UK context is there's some wonderful work has been happening around crisis prevention through the legislation. But anything upstream from that, despite knowing about populations at greatest risk, we've really not been effective in our efforts to prevent homelessness. And we are in a relatively abysmal place around universal prevention because of our decimation of our welfare state. So it's been a useful tool, and our argument is, look, in any context, in any country, you could use this tool to help think through where you're at. And that's what's happening. So we've seen this now being used in Wales to inform national policy development. We've seen it at local government level, so local authorities saying, what actions are we taking? What gaps do we have in our services and our interventions? It's also begun to influence discussions across Europe. And to some extent further afield. But really, the crucial point about the typology is to lay bare the gaps upstream and to drive governments, charity, and others to really turn their attention to those sorts of interventions. And really, my last point to say is, and there's been no time to talk in detail about the actual research itself, but to say, in all of these examples, the research is only ever impactful on policy and practice where the process is inclusive and collaborative. It's in working with, not on or about the sector and people experiencing homelessness, but actually working with is where those findings then have traction and lead to impact. And if any researchers are tuning in, the message is, you finish your research, that's when the work starts. You've got to be prepared to kind of stick around well beyond the completion of the research project. And to really give a concrete example of that before I finish is to say the work on the homelessness legislation that I did started in 2012, and I'm still working with Steve and colleagues in Canada now, looking at the potential mobility of those policy ideas. So that's all I wanted to say. Diolch yn fawr. Thank you very much. Gracias.
Thank you, Pete. Really, I think interesting to start that out with sort of the policy and legal frameworks, as that's really the underpinning of so much of this work. And then I found that chart really helpful as well, kind of the different levels of prevention and how you're articulating it. And I know some of our forthcoming speakers are going to touch on some of those different levels. Pete, if you do want to put links to your research in the chat, we can also send those around in a follow-up email to people. I know it's been a really instructive and helpful piece for the IGH team in thinking through some of those things. So definitely recommend that as a read for everyone here on the call. Introducing our next speakers, we have representatives from Making the Shift, a youth homelessness social innovation lab based in Canada. So we have Dr. Stephen Gates, who's a professor in the Faculty of Education at York University in Toronto. He's the president of the Canadian Observatory on Homelessness and the Homeless Hub at York University, as well as co-director of Making the Shift and the Toronto Center of Excellence on Youth Homelessness Prevention. Along with him, we have Amanda Buckney, who's the manager of the UN Geneva Toronto Center of Excellence on Youth Homelessness Prevention at Making the Shift. And she's also a PhD candidate at the University of Guelph in the Social Practice and Transformational Change program. So I'm very much looking forward to hearing about prevention from their perspective. So Stefan, over to you.
Great, thanks. I'm going to throw up my PowerPoint here, and Amanda and I will take turns on discussing the content here. Okay, it hasn't gone. There we go. Okay, so we're going to talk about the whole idea of research impact in the context of understanding homelessness. So I used to work in the homelessness sector in the 90s in Canada. And at that time, there was a real anti-intellectualism about the role of research. It was like, we don't need research. We know what the problem is. We know what the solution is. And I think all those three statements were wrong. That was at the same time when the HIV/AIDS crisis was huge, was a pandemic. And curiously, within that issue area, research played a big role, but there's a real reluctance to have it do anything. So it's been a long time to try to really kind of seed research in as being important in understanding homelessness in Canada. So I'm going to talk about the issue of prevention because in North America, prevention has been slow to rise to prominence as a way of thinking about homelessness. Basically, there are three things you can do to address homelessness. You can prevent it from happening in the first place by helping people not become homeless. You've got a crisis response that you're going to need, regardless of how good your prevention is, because not everyone will be successful in being prevented. And then you need housing and supports to help people move out of homelessness in a way that ensures they don't return. So they get the right kind of supports. Now, in Canada and the United States, I'd argue the bulk of our investment historically has been that crisis response in the middle and continues to be. The good news is that there has been a shift now that particularly in Canada, the United States, a paradigm shift, the dominant paradigm, which has been in the United States since about the year 2000, the turn of the century. And it involves basically three key components here. So the first is housing first, research-driven intervention. It is one of the few things we do in the world of homelessness that you would call a best practice because of the overwhelming weight of the evidence. So you need housing first. You need to optimize the homelessness sector to deliver on housing first. So things like coordinated access or coordinated entry, depends what you call that, basically gets the sector to work together to help people and prioritize people. And then the third thing is targeting chronically homeless people. So Peter alluded to this. This is not a universal approach. This is one that prioritizes chronically homeless people. And we've lived with approaches to assessment for prioritization that are not scientifically backed up for a long time. So we've put in place this, and there's a kind of and the idea is that if we do all of this and do it well, we'll end homelessness. And all of these things I agree with, that we should, particularly the first two, the targeting the chronically homeless and prioritizing brings with it some unfortunate consequences in that it relies or requires people to wait until they're homeless enough or sick enough to get access to the supports that should be a rights-based thing. And so we have to get there. So key here is that research played a big role in conceptually shifting the work, but also practically providing evidence about how to do this work well. Now, will this end homelessness? If we just focus on this, I don't think we will. I think it's absolutely key and central to what we do, but it's not sufficient because we're ignoring the inflow into homelessness. So I'm going to show you some data from the United States. This is from the annual report from HUD to Congress, I believe in 2020. And we don't have updated data because the pandemic made doing point-in-time counts really challenging. But what you can see here is that between 2009 and whoops, I've got the slide in the wrong order. Okay, between 2009 and 2020, you saw, chronic homelessness go from 120,000 down to around 77,000, then back up to 110. It's probably, we don't have data, but I speculate that it's higher than it was in 2007 now. Now, that shows an improvement in the middle, and I think we know why. So let's look at veterans homelessness. There's a big effort that started under Obama to invest heavily in veterans homelessness, and you see that it basically cut by 50% the number of chronically homeless people, right? And so that was a dramatic drop. How did that happen? There's an unusual context there that enabled a systems response that goes beyond the homelessness sector to actually solve this problem. And that's called Veterans Affairs, which has, it's its own integrated system. So not only is there income supports, counseling, housing, there's also healthcare. So the US government was able to marshal that complex set of systems that are within Veterans Affairs and extend beyond it to actually do that work. The challenge is that's not easily replicable outside of Veterans Affairs because public systems are fragmented, are not necessarily coordinated that well, and it would take a huge task to recreate that. So this then raises the question, right? If we go back to here and see that homelessness climbs up again, there's no doubt that we know that Housing First works and other housing-led programs are important and that we're housing a lot of people, but we're ignoring the entry into homelessness. And so if we want to succeed on ending homelessness, we have to combine the things that we're doing well around housing people who are currently homeless, but we also need to focus on prevention. And I would argue a big lesson from what's been done in Wales is that approach to prevention should not involve prioritization, because I don't think we have the tools and the mechanisms to accurately predict who shows up on the first day at the shelter will transition to chronicity, right? We don't have the research that will help us do that yet. So it should be open to everyone. So the change we want to see is basically to move from something that looks like this to something that looks more like this, where our investment and activity focus more on prevention and housing and supports, And the emergency response is there to do what it should do, which is provide crisis supports. When you're chronically homeless for 20 years in the shelter system, you can't call that crisis supports anymore. What you can call it is a weak and inadequate response to homelessness. So what's the role of, wait a minute, let me see. So in some of the positive changes that have happened are in recent years, and this took a long time in Canada and the United States. There's been little bits of prevention happening at municipal levels and state levels, provincial levels, and in the federal government, but there hasn't been consistent thrust. And in Canada, when it redesigned its homelessness strategy several years ago, made these the mandatory outcome areas for the communities it provides funding to. And you'll notice these two at the bottom here, focus on prevention. So that's a radical shift conceptually in the thinking about how we respond to homelessness. The challenge is, to Peter's point, it's not legislation based, and there isn't a clearly articulated strategy of how to support communities to address new inflows or returns to homelessness. The great news in the United States, they released their federal strategic plan last December. That was quite a September surprise for me. But anyway, in that plan, they are foregrounding the prevention of homelessness, which was delightful. And, you know, I think that lots of people have been arguing for this. Jeff Olivet at the National Alliance Conference last summer was saying, you know, like, we're really good at housing people. We've housed this many last year, but the problem is this many new people showed up into homelessness, right? And so that shift, conceptual shift, I think, is informed by data, right? So the data I showed you from the HUD report, we have to take that seriously, right? And we have to like be honest about the limitations to what different things can do. And Peter, I'm very glad at your humility around, you know, the impact of the work that's been done in Wales. I still would call it, what's happened there for me is the biggest paradigm shift in how to think about responding to homelessness since Housing First. So, so though there are not everything's working out, you're really at the beginning. So supporting that conceptual shift, Peter mentioned the definition and typology of homelessness that is being used in the UK with the Canadian Observatory and making the shift. We've been working on a definition and typology that is more driven to the structures and systems in Canada. We're in the process of updating and revising them, where we need to take more of an EDI lens to the work, and particularly regarding Indigenous people who are greatly overrepresented. But that's an important role of research, is supporting that conceptual shift, right? How do we change people's thinking about how to understand a problem, what to do? Now, we're focusing a lot in Canada on talking about youth homelessness as key around prevention. And it usually isn't thought about, right? Because we think of young people as healthier, and, you know, we need to really focus on, you know, people who are older. But we know from the research in Canada, from our national point in time count, that 50% of all people who are currently homeless had their first experience before they were 25. And this next one, this is my favorite table from 2022. This is an all-star piece of data analysis from our government of Canada that looks at the age of first experience of homelessness. And what you can see here, the thing to pay attention to is between the age of, say, 12 and 20, that's the peak years where there are entries into homelessness. And the challenge is that at a policy level in Canada, whatever order of government you're talking about, youth homelessness has not been a priority. And that's a big problem, because if we were to address youth homelessness effectively through prevention, we would likely not only improve the lives of those young people, but we probably have a big impact in the long run on chronic homelessness. Because every chronically homeless person showed up in the homelessness sector or on the streets for the first time at some point. And so if we can get in there when we were talking about developing adolescents and young adults, that's when we can have the biggest impact. Okay. Going to try to move along here. We're going to move to what's our approach to solving the problems through social innovation. I'm going to hand this over to Amanda to do a run through, and then we're going to talk about Peter's point about the heavy lifting really happens after you've done your research. So Amanda, do you have controls or do you want me to flip?
If you can flip, that'll be great. I'll let you know when. But yes, I'm going to kind of fly through this, not too fast for our interpreter, but just so, like, as you've said, we really want to focus on youth and prevention. And I think a lot of what has gotten in the way of that has been arguments that we don't have the evidence base for prevention. Not that we have much of an evidence base for the current mode of how we operate around homelessness in general, but we've responded to that through a few different things. And one of these big pieces in Canada has been this Making the Shift Youth Homelessness Social Innovation Lab. It's funded by the federal government's Tri-Council funding group and co-led by the Canadian Observatory on Homelessness, which brings that research and knowledge mobilization and communications focus with Away Home Canada, who brings the policy, advocacy, planning, and practice focus. So co-leading this group to really focus on youth homelessness prevention research. If you go to the next slide, Steve. So far, so this grant, it's a 5-year grant that enables us to fund specifically youth homelessness prevention. And under this funding, we've been able to fund 39 different research projects that cut across various aspects of early intervention and prevention, as well as sustained exits from homelessness, including a big emphasis on young people's well-being, Indigenous youth homelessness, and Indigenous-led research, and as well as technological thinking about how does technology and how do things like our ability to enumerate homelessness, how do those aspects really fit into our thinking about youth homelessness prevention, things like administrative data, et cetera. So a key component of this work has been demonstration projects. If you go to the next slide, Steve, actually. So demonstration projects are what, in our mind, really bridging that research and practice and working together around how do we not only evaluate a program, but how do we think about the design and bring research along that journey with the community and with the community organization to develop the program, prototype it, test it out, and evaluate it in real time so that we can share out those learnings with other communities and that can adapt these different practices and approaches to their own context. And you go to the next slide, Steve. So these demonstration projects that have been ongoing even since 2017, before we got this big research grant, have been looking at across this kind of spectrum of early intervention to exits from homelessness. And if you go to the next slide, I'm going to go quickly through what these kind of different areas have been that we've got some demonstration projects going. So first is enhancing family and natural supports. And this has ended up being something that's been kind of cross-cutting across all of the work that we've been doing, has been realizing that working with families, working with the natural supports that young people have within their communities that are often cut off or lost by the time they reach a shelter system or maybe move to a new community, focusing on how to build those natural supports that are going to be with them beyond a paid service, beyond a paid program intervention is really essential. And if you go to the next slide, Steve, Youth Reconnect is another program, early intervention program, that's focused on school and community partnerships that can keep young people in place. We know that every young person at some point was in a school context, mostly. So what can we do to make sure that those young people that are experiencing challenges, not just with housing and homelessness, but even earlier than that, dropping grades, those kinds of things, how can we get those young people in connection with community partners? If you go to the next slide, in a related kind of program, which is one that Pete also mentioned, is the Upstream Project, which is another form of school and community collaboration and screening of young people to make sure, making sure young people, as well as their families and natural supports, don't fall through the cracks before they fully drop out of school and end up without no housing. Go to the next slide, Steve. And then Housing First for Youth. So taking a look at Housing First, as Steve mentioned, that's been a really a leading approach in Canada and elsewhere around addressing homelessness. But one of the challenges was that it was designed through an adult focused lens and didn't really think about young people's development and what's needed to support youth specifically in housing them once they're exiting homelessness. And so what we have is a number of different demonstration projects that are focused on some different aspects of youth homelessness and exiting youth homelessness, including youth that are currently experiencing homelessness, early interventions for youth that are exiting care, which has been something that's come up in Europe, especially as a big focus in their Housing First for Youth work. And then Andayang is an Indigenous-led Housing First for Indigenous Youth program. Okay, next slide. I think this is back over to you. That was very quick.
Okay. So we think a lot in our work and have for a long time, like how do we create impact, right? As researchers, we're not trained to do this generally, right? We're trained to publish in scholarly journals. And so in our work, we've done a lot of experimentation on this, done a lot of research, paid a lot of attention to the research on research impact and implementation science. And we've created an approach that speaks to what happens once we generate the knowledge, right? And what we want to do, right? And this takes time. Implementation science tells us very clearly that you have to be really patient, that whenever you have an innovative thing that you demonstrate can work in healthcare or whatever, it can take, more than 8 years for it to be broadly embraced. So it takes time. And that's where legislation can help and more direction to communities about what they should be doing. But what we want to do is move organizations, individuals, funders, government along what we call the commitment curve, where they first come up to an idea and are exposed to it. They become aware or not, they understand it. And over time, they start to think about it positively and imagine they could implement it and then start to figure out how that would work and then eventually implement it. And if it works, take it to scale across their system so that it's effective. Now, that's a challenging piece of work. Like, how do we get there? And I'm going to go quickly through this, but we do the research and we focus on scholarly research outputs, but more than that, we focus on public-facing resources. So we translate the research into usable reports, tools, policy briefs, et cetera, that are not out to embarrass, but rather are there to give people support and direction. And we evolve these things along the way. So we developed the Housing First for Youth model almost 10 years ago, and we keep revising it based on what we're learning. So it's that iterative relationship between research and practice to the point now where we have if you look on the right side, the program model plus an operations manual that gives incredible support around case management and this kind of thing. We have a very robust communication strategy where we are able to, push these things out, but also target them to audiences that are important to us. The key thing, and Peter, you mentioned this in yours, and this is really key. Researchers alone cannot create impact. We have to work collaboratively with people with lived experience. We have to work collaboratively with government service providers across the way and learn from and share from and conduct research with. So government relations is a big part of our work. This will look different in every country. We have 3 orders of government, federal and then provincial and territorial and then municipal. And constitutionally, they have very different responsibilities, but it's important to get, because government's the main funder of homelessness work, to get them to move along that commitment curve. We've got them moving along it, but we need to get them up to the top. Community engagement is a big deal. We communicate with our partners. Away Home Canada runs the National Learning Community on Youth Homelessness. We have a newsletter with over 25,000 subscribers, and we do public presentations all the time. And it's surprising. It only occurred to us later on that kind of work, that face-to-face kind of work, is really important. We have training and technical assistance now. So all those interventions Amanda pointed out, we're able to support communities to implement them, because it's a big leap to go from we want to do this to figuring out how to do it. So I'm going to just wrap that up, Amanda, if that's okay. And then maybe you can say just a brief final thing about the Charter Center of Excellence.
Yes, so recently we were given a designation by the UN Economic Commission for Europe to become one of their charter centers of excellence, promoting the UN Charter on Sustainable Housing. So this gives us an opportunity to do more things like what we're doing today, of connecting with folks internationally and exchanging knowledge around what's happening in other communities. So if you want to follow along with what we're doing, we can share more about that at a later time, but I think that's all I'll say about that for now.
Yeah, and I just want to say one final thing, like international engagement. So the work of the IGH and this body of work are really important, because for me, the big paradigm shifting moments in my life have come through seeing what people do in another country. And we need to not see that as like, oh, we can't, the policy context is so different. We have to go in there and figure out what we are learning. How do we apply it at home? So thank you.
Great. Thank you, Stefan and Amanda. So many interesting things coming out of that, but we are running a little bit short on time. So one quick thing I'll note about the Veterans Initiative on Homelessness in the United States. Everything you said was right on, Stefan. The other component was there was a huge push for mayors to be involved. And I know we have the mayor of Lethbridge, Alberta, Canada on the call with us. So shout out to their office, because again, the role of mayors in addressing homelessness locally is really, really key. And my colleague Lynette from All Chicago will remember we used to get phone calls from the mayor's office asking us here in Chicago how many people were homeless, how many veterans were homeless. And you don't really want to take that call if you don't have a good answer on the other side. Okay, it is now really my delight to introduce Ignacio Eisman. Ignacio is a sociologist and has his master's degree in government and society from the Alberto Hurtado University and a PhD in social work and welfare policies from Boston College and the Alberto Hurtado University. He is the co-founder of Corporación Moviliza, an organization dedicated to developing programs to overcome homelessness in Chile. He is also the co-founder and director of the Center for Research and Advocacy to Overcome Homelessness in Latin America. He is also the director of studies and advocacy of the Jesuit Migrant Service in Chile. He will be presenting in Spanish. So if you need interpretation into English, please select the English channel from the globe at the bottom of your screen. Ignacio, over to you. Thank you for being with us.
Thank you.
Thank you very much. Good afternoon, good morning, depending on where you all are at. Well, firstly, I appreciate the space from IGH to be able to present and also to be able to do it in Spanish. For the Latin Americans, it's very important to be able to express our ideas in our own language and to be able to listen to our own thoughts in our own language. So as a context for my presentation, the programs for homelessness in Chile are very recent. It wasn't until 2006 that we had our first psychological support program. And it wasn't until 2012, 10 years ago, that we basically have shelter programs. Accommodation programs that are mainly presented to urgent, emergency, residency, transit, temporal residency and housing, which is called shared housing, like what happens in Spain. And from 2018, a program for adaptation of Housing First, which is called Housing First or the supported housing, which is generating a lot of discussion in terms of whether it's really faithful to this model or if it's more an approach to housing debt. But if it effectively introduced a new argument in Chile in terms of its role, the role of housing and the right to housing for all the people in Chile. Another important piece of information in our context is that the social protection systems is started once we recovered our democracy at the beginning of the 90s, but with a strong neo-liberalist test, and which happened during dictatorship. So that's why we have the discussion of right. It's not something that we have common sense in Chilean population because of this neoliberal vision. When the public policy thinks in a homeless person in Chile, they're thinking only for people that are living literally on the streets or in emergency shelter. They're not always thinking about the people that are at risk of being homeless, or even those who live in makeshift houses like the ones we see on the right-hand side of the picture, or people who today are crossing the borders that are coming from Venezuela, because there's been a huge wave of Venezuelans, very important. Not always in this group do we see the lack of housing. So that's very important because the role that the institutions have had, and also this new program, have enhanced this vision in terms of homelessness. So I could say that today, most of the people, public facing people, constituents, academia, they see homelessness from level of people who live on parks or in the waiting room of a hospital or in emergency housing. In the last years, from investigation of in institutions, we began to see things in an in an invisible manner. So we talk about Corporación Moviliza or Syscall, which are new research centers. And from the experiences of people that participate in these public programs, we've been able to introduce the life history and the analysis, and also a comparable analysis, especially with what's happening in North America and in Europe, to be able to have a reference. And the inclusion of programs like Housing First have introduced the role of housing as a very important component. This idea of sharing any type of information from the access to housing has generated a new discussion, a new way of looking at problems, and also a position, the interruption of homelessness trajectories, or as an objective and a target that I would say today would have the public policy in, it would be a public policy goal in Chile. So from the standpoint of research, this is something I like to mention. The idea of homelessness as a trajectory, a pathway to homelessness, and that it's not reduced to a one-time experience in life for a moment. It only diagnoses the moment where it happens, but this new vision allows to understand that it's people that have had multiple experiences in homelessness or violence or immigration trauma, and then in these experience of loss of housing, they are agents that are looking for solutions, that are moving for solutions, and that are related with civil society and also with social policy. And finally, in terms of analytical answers, one could live different cycles in a life story to be able to understand a lot better what the policy role is, or the social programs roles are, to be able to mitigate this. This is an example for the lack of time, I'm going to go past it, but it describes the cycles and characteristics in each of these experiences. But they lead us to look at a trajectory, a life trajectory that is long. The Housing First program in Chile has a trajectory that is long. And so we're in a common element that a very great number, that a large size population has in Chile, where permanently they have to live in different houses, different family homes, friends, in children's shelters or emergency shelters, and then after having their own house, they lose their home, and it's a repetitive pattern. So what one can see is that there's a very large accumulation of disadvantages that the public policy doesn't really ever cover it. Where a 55-year-old person, when they arrive to to a shelter, an apartment, or housing, they not just need that apartment, they also need social integration, physical activity. This program started in the pandemic. So a person that lived in the streets and would walk every day 3 to 4 hours changed into a no walking reality because they're confined into a home for months. And this generated a problem that was never kept in mind. So this type of study introduces this, as well as other triggers for experiences in the case of women, evidencing the domestic violence. In Chile, it's not a homelessness cause as well as it is in many other countries where there's huge rates of violence in this sense. These studies that we're seeing nowadays is to not just look at housing, but to see housing as related to age, where we see data with women very similar to the graph that we saw in the previous graph. 15 years of age, 18 years of age, alongside abuse stories, where they explain a lot of the life cycle, and also gender violence, where in this reality, if one were to graph that, it would follow the same line with social instabilities, breakups, death stories. And also labor instability and work instability. So the answers to our policies cannot be traditional, but they have to be innovative. We have to look for another way of working and operating. So today, our programs at a reflective point are just looking at the homelessness experiences without considering the entire context. This research that is being done with state funding and in dialogue with the state are allowing to do all of these associations. Like one could divide this in layers, context of high vulnerability, where people are in some sort of a housing situation, the situations and how they can lose it, and then how they can enter into a more liberal, traditional style homelessness situation. And this model positions in a way where you have a sort of interrupting these stories and preventing them to go back to the streets, but without including them in a social protection system. So that's where something very similar to what Peter was mentioning. There's no legislation, no law that supports social protection in terms of housing. And so we have, because of the new constitution from last year, where one of the norms was the right to housing. So there's a logic of understanding that is not rooted in the constituency and in the citizenship and in the citizens here. So even though this model adjusts or not to fidelity of housing first, but there's also the discussion. And so we hope that in the next 10 years, we can have more sustainable responses and answers where the lifestyle, this life story would prevent and would intervene in the homelessness to be able to prevent it, and even beyond residential stability, and with a social situation that is more robust, like Finland's example, that saving the difference in resources that we have in Latin America. There's a lot of public decision and political will to be able to affect these public changes that we don't have them yet, and to be able to conclude these studies have been adapted to be able to incorporate an age and gender as variables, to be able to consider them in the design of the program, and to be able to consider life stories and different strategies to support work and social differences, etc. So my appreciation for being able to have this space and reduced time, but thank you very much. And that's the end of my presentation.
Thank you so much, Ignacio. Great to have you with us and sharing more about the context and the work in Chile. I definitely picked up on what Stefan said at the end of his presentation about the importance of the international learning. I think one thing we have found at IGH is the challenges are far more similar than they are different, and there is so much that we can learn from each other. And so with that, I'm going to plug our upcoming conference. I think all of our speakers today are going to be with us in person in Chicago at the end of next month. So if anyone on the call is interested in coming in person or joining us virtually, I will put that link into the chat. So we have just a few minutes left for questions and answers. And so our first question comes from Candace Noble, and they say, the challenge I am running into is that it is hard to produce outcome data on prevention work. We can do that more with crisis prevention, but when we go further upstream and think about universal prevention, it's difficult to produce impact data, and that lack of data makes it difficult to secure funding for the work. So do you have suggestions on what data is critical in prevention work? Pete, I'm going to send this to you first.
Oh, it's a great question. And I feel such a fraud with the data that I did present, 68% prevention. What does that mean? And that's the point that always gets relayed back to me. How did you know that 68% of people weren't otherwise going to self-solve? In the policy context, we deal with that by simply saying somebody came and asked for help because they're at risk of losing their home. We help them. They've still got a home or they've got an alternative. So we don't worry. But the dilemma of proving prevention works is an important one. And the UK, we're really weak. In North America, much stronger, partly because of where our funding for research and policy around homelessness comes from. In the US, it's a lot of health money. They do robust research. We don't in the UK context. And in robust research, I mean trials. So you would have clearly defined control groups. If you're going to develop an intervention, you'd have a clearly defined control group, and it is ethical to withhold an intervention from one group in order to demonstrate its effectiveness. That happens in the US context. We are only just at the start of that journey in the UK. I'll give you one example of a really good one that I've just learned about. It's one of the boroughs in England has been using predictive data analytics. And they basically use this predictive data analytics to identify people at risk, help them, and stop them even entering our homelessness system. And they basically worked on what you would call a waitlist design. So they could only help, let's say, 50 people. There were another 50 people with slightly lower risk levels that they couldn't help simply because of capacity. When they monitored the outcomes for the two, of the 50 that they helped, almost nobody entered the homelessness system. Of the 50 that they couldn't help, who had lower risk levels, I think about 40% of them entered the homelessness system. So they were able to demonstrate, and this is a live local authority example. It wasn't even a research organization doing this. It was just a local authority doing it. And they were able to demonstrate. That would be very similar to a waitlist design. But trials methodologies that we'd be borrowing from health, that's what we should be doing more of. But it's a big journey for us as a homeless sector because we don't do it very often.
Thank you, Pete. Ignacio, I'll send it to you next. How do you think about prevention data in Chile?
Sí, en el caso de Chile.
Sure. In the case of Chile, the state has very good information from the constituency and from citizens. And so it is in terms of monitoring ins and outs of homelessness. So I would change the question. The challenge is not so much the data, but the questions, to be able to use data and to have better replies and responses for this phenomena. But I consider, just like it was mentioned in other presentations, that that the link between government and research are fundamental to be able to have these data, to be able to use them and generate responses. It's been very laborious for us because the government, for the government to give us data, but we're continuing to insist. The data exists in Chile. That's the good news.
Great, thank you, Ignacio. And last but not least, Stefan and Amanda.
Thank you. Yeah, I think that question gets raised a lot around prevention. And I think Peter answered it well. We need to adopt controlled trials more. That's very well-established approach to measuring outcomes. Predictive analytics, I'm glad you mentioned that. And I saw an article about what you were describing, which was very interesting, and being able to, because our knowledge about, you know, people's trajectories is not so strong, and we're not collecting the right data to determine that. The other thing I would say is the use of linked administrative data, which in Europe, in many European countries, they're far ahead of what we are in Canada. I know in the US, there's a lot of work in that area, but that gets us access to health data, employment data, income data, you know, involvement in the justice system. And so we can understand people more than we do now. And to go back to my first point about the issue of outcomes data for prevention is a challenge. The reality is, I don't think we have great outcomes data for the crisis response or getting people housed. We track people in rapid rehousing for 3 months and then make assumptions that they're stably housed. We track people in housing first programs for as long as they're in a program, but you know, you really have to have a longer term. The question for all of these interventions, are we preventing their homelessness or preventing their return to homelessness, or are we just delaying it? And so we need to get better data, higher quality data, the right kind of data before we can make strong claims around are we effective? And also, you know, the randomized controlled trials that Peter mentioned are like fantastic. The challenge is that it's expensive to do. But if people really want that good data, then we have to invest in it, and we have to improve our data management and data collection in the sector as well.
Great, thank you. Amanda, did you have anything else you wanted to add to that?
Yeah, just quickly to add to what everybody else has said. Also, I think one of the key components, because Candace, you talk about the challenge of getting funders on board. I think in addition to getting the data, there's the education for funders and governments around different responding to different kinds of data and different information. For example, if numbers in shelters or bed nights in shelters are going down, really understanding that that's not a bad thing, but we tend to fund capacity, not necessarily being able to prevent homelessness, and redirecting those funds toward more prevention and family-based supports and those kinds of things. So there's an education piece around that too that I think is really important.
Great, thank you. Well, we're 5 minutes over. So thank you to all of our wonderful speakers today, to all of our attendees. Particular thanks to my colleagues Julia and Tiffany, who helped to put this together. There's a lot of work that goes on behind the scenes to pull something like this off. So shout out to the IGH team. We'd love to see you in Chicago with us. So do look at the IGOH conference website, and there are also some virtual attendance options as well. But you know, Chicago's really lovely at the end of March. Yeah, so just thanks again. Great to see you all. And we will be sending a follow-up email with links to the recording and all of those things. So thanks again, and have a wonderful rest of your day wherever you are in the world. And thanks to our wonderful interpreter. All right, take care, everyone. Thanks so much. Bye-bye.
Thank you.
Bye.